you're speaking now as a nurse. You are a nurse.
Yes.
So you know
I'm
what it is.
Nurse. I'm a wound nurse. And so the things that I see and how infection can spread very rapidly, depending on the type of infection that you are dealing with. It's really important that people understand the ramifications of it. Now, what stops infection is when you can clean it. So what's the first line of defense? Hand washing. Now, we're glad to have the little hand sanitizer, and I'm glad we had it. I washed my hand 10 times on the plane, okay? But when I got off the plane, the first place I went to was the bathroom and washed my hands.
Miss Jacky, I did a show not too long ago, and I said on the show, why is everybody running to the store to buy hand sanitizer as if soap and water don't work?
That works better than anything. That is the first line of defense. There was a movie out about a doctor. I can't remember the movie now. I think it was Dr. Carson, how Dr. Carson became, it may not be Dr. Carson.
It's called Gifted Hands, right?
Yes, and they were spreading this infection and didn't understand, but the doctors were going from surgical site to another surgical site without washing their hands. They were wearing gloves, but they didn't wash their hands. Now, a glove can always have a hole. So you don't know. And because I do wounds, I have to wear gloves with everything that I do. However, because I wear gloves, there have been times when I've gone into a wound, cleaned the wound, and when I go to take my glove off to dress the wound, my hands are wet. So that's why we have to be so careful and understand that first line of defense is hand washing. And 20 seconds is all it takes. But it's, after all, if it's going to save your life, 20 seconds is good.
so do me a favor and
yes.
Tell me about what nurses go through, because right now, nurses and doctors are the men and women who are literally working to save a nation from perishing. Talk about what nurses go through. Matter of fact, let me change the question. Talk to me about the heart of a nurse.
The heart of a nurse is, our passion is to make sure that we take care of you. The reason why I went into wound care was because my exhilaration came when I could see how a wound comes in, like when a person has a diabetic wound and they come in and it's a stage 4, which is open and it's necrotic tissue there. But when I see it, I see a clean wound, because all while I'm working with that patient, I'm praying, I'm anointing myself so that when my hands touch them, that God can use me. But the most important part of a nurse is to be able to see you come in sick, but go home well. And if we can get you, because some people come in, they're comatose. If we can get you to wake up, sit on the side of the bed, and go home, we done our job. Right. And that's what's so much better for us. What hurts us now is when people don't want to obey, when people want to come and know that they don't, see, we don't know where you've been. The way the virus is spread is, it could be on your clothes, on your hands, and so in your mouth, in your nose, because it's airborne. And because it's airborne, it can be spread very easily, and it can stay in the air. So that's why they're telling you to wear a mask. It's just to help you. So if you want to make a nurse happy, thank them when you see them, and do exactly what they ask you to do. If they say don't come in, don't go in. Try to be obedient, because we're just trying to make the other person feel good and get better.